Hi, so I guess we're streaming live. Hi, Dr. Surya. I guess we'll just wait for 1 more minute for everybody to join in, and then we'll.
Yeah, sure. Yeah, Prabha. Yeah, it's it.
Yeah, hi, Dr.
Yeah, they have joined. Yeah. Okay.
Okay.
Yeah.
Okay.
Okay, I guess we should start now.
Yeah, we can start.
Okay, so we're streaming live. Hi, everyone, and welcome to our live session on immunity in moms and babies. So today we'll be discussing about the most common things, and immunity has been quite the buzzword, right, when it comes to moms and parents. And in the past year, COVID has made it so important. Every other mother wanted to know how to increase my child's immunity, what to do if you're breastfeeding, and babies who haven't started their solids, how can their immunity be increased. So in this session we will be cracking the code about immunity in moms and babies, and for that we have with us Dr. Surya Bhagwati. So before we dig into all of these questions, a bit of introduction. I'm Dr. Rahat, a physician, a writer, a mom of two, and host of Dr. Mommy Speaks Parenting podcast. And our esteemed guest today is Dr. Surya Bhagwati, who is the in-house chief officer at Dr. Vaidya's Ayurveda. She has been working with them for the past 5 years, and she has an extensive experience of 30 years in practicing Ayurveda. She's treated over 1 lakh patients via online consultations and OPDs. And what's great is she's a Panchakarma practitioner. She's treated almost 1,000 patients using Panchakarma. Hi, Dr. Surya. It's great to have you in our session today.
Thank you. Thank you, Dr. Rahat.
How are you?
Fine. Thank you. So before we start with the questions, a little bit more about my co-panelist, Dr. Rahat also. Let me also speak about you. Dr. Rahat is an ICU intensivist who works in a critical care department since 5 years. She is an author, as she also mentioned that she is the mother of two. She is the host of Dr. Mommy Speaks Parenting podcast, where she has international guests from around the world who are pediatricians, gynecologists, gastroenterologists, parenting coaches, nutritional therapists, psychologists, etc. They all discuss various topics related to child health, modern parenting problems, and their solutions. So welcome, Dr. Rahat, on the show.
Hi, thank you so much, Dr. Surya, for that amazing introduction.
Yeah, and can you tell us something more about how it got conceptualized and who should listen to your podcast?
Podcasts, actually how this all happened. Now, whenever we have a problem, I'm sure you also must have noticed this. Whenever we have a problem, we first tend to Google it. Like if my baby's not gaining weight, or if he has mild fever, rather than calling a pediatrician, we tend to Google it. Now, Google is more than enough if you want to complete your assignments or homework. But if it's your child's health, that's not the one you want to trust. So I wanted to create a resource that is really credible and can be trusted. So that's how Dr. Mommy Speaks Parenting podcast happened. And there we have only expert interviews. And why did I go for podcasts? I think podcasts are made for parents, especially if you're a mom, because they're like so easy to consume. You could be feeding your child, driving to work, or maybe doing laundry, and you could just switch on a podcast and get the solution to the problems which have been troubling you all over the night. Like, why is my child's height not growing well? Or is my child having ADHD? Or what is autism? Anything of that sort. So I try to make it as a wholesome experience for the listeners, and they can get questions, answers to all their questions related to health and parenting. And
Great.
in
That's
fact,
great.
currently we are ranked number one in parenting podcast category of Luxembourg and Switzerland. So I'm so proud about that.
Great. Great, Dr. Rahat. So let's start with some few questions around the immunity.
Yeah, sure.
So let's start. So first question I would like to ask you, what immunity is passed from mother to her baby?
So it actually all starts from the last trimester of pregnancy, the last 3 months. That's when the mother transfers her antibodies. You can think of antibodies like bullets that kill the bacteria and viruses. So she transfers these bullets to the child in the last trimester, and that's the first set of immunity that the child receives.
Yes.
Now, what the child is going to receive depends upon the mom's immunity as well. Like if the mom has had chickenpox, then she will have the antibodies to chickenpox, and that will be transferred. Or maybe say a flu shot, so the flu antibodies will be transferred. And after that, when the baby is born and starts breastfeeding, colostrum is the second step of immunity, where the mother transfers immunoglobulins into the child's body.
Right. Yes. So how do babies build immunity?
So like I said, we can think of it as a three-step process. First was when the mother transferred the immunoglobulins, the antibodies, in the last trimester of pregnancy. After that, there came the breastfeeding stage. That's the most important stage, where through colostrum, the mother continuously starts. Colostrum is the first milk, the yellowish, thick milk, which is coming out immediately when the baby is born. So that's the second part of immunity, which the baby gets. And after that, the baby is going to get the vaccinations. Now, this immunity which the mother has transferred, it's not going to stay forever. It will disappear in some time, say a few weeks or a few months. So we need to top up the baby's immune system with another set of antibodies as soon as possible. That's where vaccinations come into picture.
Right.
So we have vaccinations at 0, that is at birth, and then 6, 10, and 14 weeks consecutively. So before the mother's immunity has even gone from the baby's body, we have topped up with another dose of antibodies into the baby's system.
Yes.
And as the child grows, the best way that the child gets his immunity is by getting exposed to a variety of bacteria and viruses. So now that's not, I know it sounds bad that exposing your baby to viruses, but then how it actually works is the baby needs to come in contact. So if your child, when he grows up, he starts playing outside, or if he's in contact with a child at play school or daycare, that's where different bacteria and viruses they come in contact with, and the body starts making antibodies against each of those viruses. So that's how it works.
Yes, right. So let's go to the next question.
Yeah.
Do breastfeeding moms have strong immunity system?
Well, exactly. Breastfeeding mom doesn't translate into a higher immune system. But if you run around the bush, then yes, you will have a stronger immune system. Now, how that happens when we talk about the benefit bond with the baby, the mother and child will bond well if they're breastfeeding. Other than that, there can also be, when it comes to the mother, there are certain hormones which are released, like there's oxytocin, there's serotonin.
Yes.
In normal words, these are the happy hormones. And okay, we have a question. I guess we'll take that. How long does maternal immunity last?
Yes.
So maternal immunity, like I said, it lasts for a few weeks to a month. It cannot be lasting more than that. So that's why we need to vaccinate the child even before that, so that the mother's immunity, even before disappearing, is been topped up with another set of immunoglobulins.
Okay.
So coming back to the question, breastfeeding.
Huh.
So when a mother breastfeeds, she has tons of benefits for it. Number one is the happy hormone and the love hormone. These are hormones which are released in the mother's body when she is breastfeeding. Now these are going to help the mother to reduce her stress. They're going to help her stay happy and keep postpartum depression at bay. I'm sure we're all aware of PPD and how much it started to affect moms nowadays. So it has been seen in research that moms who have been breastfeeding are less prone to getting PPDs. Other than that, breastfeeding also provides a mother protection from certain cancers like cervical, ovarian, and breast cancers. And lastly, when a mother is breastfeeding, she needs to provide all the nutrients to her baby. So
Right.
the body tends to absorb a lot of calcium.
Right.
And this point where the baby body absorbs a lot of calcium helps the mother to increase her bone density.
Right.
In simpler terms, you're going to have a stronger set of bones if you've been breastfeeding for a longer period of time.
Right.
Now, all of this ultimately translates into a very healthy body, and the longer you've breastfed, you're going to be healthier longer. And that means you have a stronger immune system.
Yes. So one more question. How can a mother boost the immune system when breastfeeding?
Yeah, that's an amazing question because, of course, if I'm a breastfeeding mom and I need my child to be strong, I got to
Yes.
be strong first.
Yes.
So,
Exactly.
so how we can be tackling that is, so a mother has to be eating healthy is number one.
Yes.
For that, we need to understand that what actually is this immunity. We should know that about 70% of the entire immune system is based in your gut. That means what you eat is exactly going to translate into your immunity. So our gut is made up of many bacteria, almost 1,000 different species, and these different the thing where there's a biodiversity in these species. This is very important. Now, certain lifestyle changes are going to hamper this biodiversity, like eating a lot of processed foods, eating sugars, or not exercising. All of these are indirectly going to suppress the gut flora, or
Right.
taking a course of antibiotics.
Right.
And once gut flora is suppressed, your immune system is going to be suppressed. I'll
Yes.
give you an example here. Sugars, as simple as that. Like I had a craving, I'll have a Cadbury, or I had a bag of chips. These processed foods and these sugars, impact our gut so much that they're going to be suppressing your immune system for hours together,
Right.
just one time when you had it. So that's how harmful they are for our body. So at least for breastfeeding moms, we first, to improve our immunity, we need to take care of our gut. So whatever we are eating has to be on the healthier lines. So try to keep one food item from each of the 5 food groups. I'm talking about fruits, vegetables, proteins, and simple minerals and nutrients. Now, of course, it's not, in our everyday day-to-day lifestyle, we don't make up a plate and we're like one portion of protein, one
Yes.
portion of carbohydrates. We don't do that. So how you can go about it is eat your normal everyday meal. Try to stay away from processed food, but take additional supplements, because our methods of preparation in which we do cooking of food and everything, we try to overcook Indian methods of preparation, and all the minerals and vitamins tend to just disappear. So what we need to do is try to take supplements, especially if you are breastfeeding. You'd obviously be prescribed by a gynecologist some set of postnatal vitamins. That will be enough to pass on the necessary immunity to your child. What
Yes.
these vitamins and minerals do, they strengthen your immune system. Your body needs them, so your immune system works easily. So that's the role of vitamins here.
Yes. Right.
In fact, Dr. Vaidyas has an amazing product of postnatal vitamins. I think we can talk on that.
Yeah. So from Dr. Vaidyas, we have got Capsule Herbal Fit, which is
Okay.
totally natural. It is made up of herbs. You must have heard about
Yes,
grandmothers
yes.
giving Chawan Prash to the children. So the Chawan Prash is very like a jam. Eating Chawan Prash, it little messy for in today's time. Or if you are traveling to carry, also it's very difficult. So, so Dr. Vaidyas have come up with Capsule Herbal Fit. It has all the ingredients, 21 ingredients of Chawan Prash without the negative benefits of sugar and ghee, which usually people of diabetic or obesity people would not prefer.
Yeah, absolutely. In fact, many moms I've come that, I'm being forced by my grandmother to consume Chawan Prash, saying
Yes,
that under the pretext of a strong immune system, but then the taste is horrible. It's not
horrible.
always sugar loaded.
Yes,
But then having it in the form of a capsule makes it so much more palatable.
yes. And one capsule a day is enough to give you all the required ingredients our body requires.
That's perfect.
Yeah,
So now let's turn the tables. Let's
yes,
use Dr. Surya's expertise to answer some of our parents' queries.
yes,
So I'll start with this a very common question. If there's, say, a 3-month-old child, so
yeah.
how can the mother boost the immune system of a child that young?
Yes. So usually for a 3-month baby, we encourage that the child keeps sleeping. Sleep is very important for the child's growth, because it is in sleep that tissues develops and the growth takes place. Second is, as you have mentioned earlier, breastfeeding. It is very, very important, because all the nutrients in the breast milk of the mother is can be passed on to the child, because breastfeed contains all the ingredients like antibodies, enzymes, proteins, probiotics, fat, sugar. This will boost the immunity of the child. So breastfeeding, even in WHO, has been recommended that 6 months the child should be totally on breastfeed. As much as possible, the mother should be encouraged for breastfeeding. Also, in children, we can in from Ayurvedic point of view, we advise massages, oil massage. When you massage a child with oil, the blood flow in the body, it will be stimulated. That will also help in the growth of the child. Also, light exercises before the massages are done to the children by the caretaker or the parent, like stretching of the legs, arms. All this will help in improving the circulation, and also will help to improve the growth of the tissues of the child. Second, also, as you already mentioned, vaccination is a must, which is given right at the time after the birth. It is there are schedules where the child is given vaccination, so this can also help to improve the immunity of the child. And also, I would suggest the kangaroo care, that is the parent giving to the child, the body touch of the parents to the child, that will help the child to develop immunity and antibodies in the child's body. So this will help the 3-month child to grow in a very healthy way.
Absolutely. Those are some amazing pointers, and a word here about prebiotics and probiotics, like you mentioned. So, we come across these words quite a lot. I see every other person wanting to have a brand. What should I consume as prebiotics, and what are probiotics, and what's the difference between the two? So, a word here about those. Now, prebiotics are actual live bacteria. Like we spoke in
Yes,
the beginning of this session, that live bacteria are the ones which reside in our gut. Our gut composes of good and bad bacteria.
yes,
So if your physician feels that your gut flora has now changed, or there's a disbalance between the good and the bad bacteria, so what we can do is prescribe some prebiotics, which will be actual live bacteria, and consuming those, you will be able to balance it out, and again that will give a boost to your immune system.
yes,
And you need not search for huge supplements or different commercially available preparations.
right,
Having plain simple curd with a spoon of sugar is going to suffice. It's the best homemade prebiotic available.
yes,
And then we can talk about probiotics. Now, what probiotics are: if you want these bacteria to thrive in your stomach, you need to provide them with food,
yes,
and their food is fibers.
right,
Remember how at every physician's visit your doctor says you need to increase fiber intake. Now that fiber intake, it's the advice we've heard all the time,
yes,
but we never pay heed to it. Here is where you need to pay heed to it. If you want a stronger immune system, you need to feed your gut bacteria, and
yes,
fiber is their food.
yes,
So that's where probiotics come into action.
yes,
And they're nothing fibrous foods like legumes or
yes,
sweet potatoes.
right,
If you're having a good amount of these in your diet, then rest assured your gut flora is being fed well.
yes, right. It's the good bacteria which everybody requires.
Absolutely.
Yes.
And since you spoke of the importance of sleep in building a child's immune system,
Yeah.
so what if there's a scenario where there is loss of sleep? So, does loss of sleep cause a degradation in the immune system of the child? And if that does happen, then how can we balance it out?
Yes. So if the loss of sleep is there, it does degrade the immunity system of the body, because sleep is very, very important to develop the tissues. Also, the immunity and the strength in the body is developed with the sleep. Sleep is equally important like a wholesome diet for everyone. That is the reason sleep has to be given prime importance. And if sleep is not as per required, then there one should implement methods. First of all is find out what is the cause that has degraded the sleep. Find out the stressors, what are the causes, like are they external or are they psychological. If they are external, one needs to work on it and remove the external cause that has caused to the degradation of the sleep. If they are psychological, then it needs to be worked on psychological level. Like if the mother is undergoing fear, anxiety, depression, one needs to work on it, because that is very, very important for the mother to see that these factors do not involve around her at the time when she is nursing the baby. Also, according to Ayurveda, we deeply believe in following the circadian rhythm, that is the sleep and the wake up time, which it should be regularly done, and should be followed very well. Uh, as the schedule should be regularly followed. It's not that few days you follow a sleeping time at 9 o'clock and then sleep at 12 o'clock. No, the sleeping time should be very much in tune with the nature. So that is where Ayurveda has a lot of emphasis on the circadian rhythm, and also exercise on daily basis for the mother is also very important, because to have a good sleep, the body also should be tired to some extent, wherein the mother, when she falls asleep, she will definitely will have a sound sleep. And there is a time to sleep. Like the best quality of sleep is between 9 to 10. If you go to sleep, the best quality of sleep is between 10 to 2. So that is the time. If the mother sleeps, the quality of sleep is very very, it's supposed to be very good, because at that time the nervous system also regenerates. And when the person wakes up in the morning, he will feel very youthful, he will feel very full bouncy with a proper sleep, will not feel drowsy. So the time is very, very important. Also in Ayurveda, we suggest, like before, if you go to sleep, you massage your scalp or your soul with oil. This will help in stimulating the cells, and will help to give you a very good, calm the mind and give you a good sleep. Also in yoga, in Ayurveda yoga, there is savasana, a practice of savasana, wherein the body is made to totally relax. And after relaxing, the mind also relaxes. There are methods like meditation. Also, pranayama helps to calm the mind. So basically, the sleep is with a very calm mind. Also, before going to sleep, one should switch off from all the electronic gadgets at least 1 to 2 hours before going to sleep. So that will help to soothe the mind. And also diet at night, dinner should be very light and it should be digestible, so that it does not trouble the sleep. Heavy food should be always avoided before bed. And even in Ayurveda, there are some herbs or tea which, when you can take it before going to sleep, even a cup of milk, warm milk at night, it contains melatonin. So it will help the mother to have a natural sleep. So having a cup of warm milk at night will definitely help the mother to have a good sleep. So these are some of the methods.
So, sleep for a new mom sounds like a dream, because I've been a mom twice, and never has the postpartum phase been so amazing in spite of having tons of help around. But
Yes.
then babies tend to be such that they have a weird circadian rhythm. where they tend to be up all the night and then they're going to be sleeping through the day. And that's the time when the mom cannot be sleeping. But then you suggested some amazing pointers. And I think Shavasana and scalp massaging are some great ways to induce a good sleep. And of course, body massages. I mean, नानी दादी ने तो कितना सजेस्ट किया है, बच्चे को सोने दो, बच्चे की बॉडी सोता है तभी ही बनती है, ये सब तो बहुत सुना हुआ है, but we got to know the scientific reasons behind it today. So thank you for that. And moving on to our next question, we're talking of immunity, and that cannot be completed if we don't cover the foods that we need to take to build our immune system. So what foods and what supplements can we take to boost our immune system?
Very good question, Dr. Rahat. Yes. So I would like to tell you, immunity cannot be built within a day. It is a daily food pattern and lifestyle that can build one's immunity. Because in Ayurveda, we believe digestion is very important. That is the first step, and immunity is the last step. So you're having a good digestion. It's not what you eat is important, but what you can digest, that is very important. So to develop the immunity, there are three main vitamins which are very, very important in one's diet. One is vitamin C. Vitamin C is considered to be boosting immunity, is the main booster that boosts the immunity. And you can find vitamin C in oranges, tangerines, grapefruits, gooseberries, and everybody, and it should be taken on daily basis, because vitamin C cannot be stored in the body, neither the body produces it. So one needs to
there. Vitamin C being a water soluble vitamin, so the moment you consume it, the body absorbs the amount that it requires and the rest is excreted to the body. So that's the reason we need to be consuming a daily intake of vitamins.
Yes. So having amla juice contains the highest amount of vitamin C. So one amla contains around 600 milligram of vitamin C. So even having one amla per day, it will all the required vitamin C can be given to the mother. Second vitamin, which is very, very important, is B6, which we do find in bananas. We also, if non-vegetarian, salmon and tuna fishes have it. This vitamin B6, it supports the biochemical reactions in the immune system, and it is very much found in green vegetables and chickpeas. So one should consume this green vegetables in one form or the other on daily basis to get the right proportion of vitamin B6. And also vitamin E. They are powerful antioxidant, which is required for developing the immunity of the body. And this vitamin E is found in nuts and seeds. In vegetables, avocado has a good amount of omega-3, flax seeds, and walnuts. You can have this on daily basis. That will help the mother to develop this powerful oxidant and give her the required vitamin E. And also adequate hydration is very much important, because water produces lymph. This lymph carries WBC and other immune systems, and also it will help to improve the supply of the milk. So adequate proportion of water is very much required. And if water, if the person does not like drinking a lot of water, you can take fruits and vegetables which contains high amount of water, like oranges, watermelon, grapes, cucumber, sweet limes and all that.
Okay, so yeah, we could also talk of some amazing recipes here that will be great for moms during the postpartum period. So green leafy vegetables. I remember during my postpartum time, I hated palak and methi, and I was like, my mother used to force me, you have to eat it. They are good for boosting your milk and immune system. But then I couldn't. So my mom had to come up with these recipes where now palak, we all know, if it's overcooked, all of the vitamins, minerals are going to be evaporated.
Right.
What you could do is just boil some palak, washed palak, in a vessel of water. Only when it slightly changes its color, remove it and place it in cold water. Now remove
Right.
that, put it in a mixie, you have that paste and it is full of vitamins and minerals. Pour
Right.
it into your आटा. आप आटा गूंद रहे हो, उसमें ये पालक का पेस्ट डाल दो, add whatever spices you like, थोड़ा सी हल्दी डाल दो, salt, black pepper डाल दो, make a dough and make parathas out of it. The
Yes.
best part is make 8 to 10 and you can go throughout the day. Have 2 in the morning, 2 afternoon, 2 in the evening, and your dose of daily vitamin minerals is sorted.
Yes.
And rest assured, you don't have to take any supplement also for that.
Right.
Like you also mentioned, nuts and seeds. Walnuts are great sources of omega fatty acids, 3 and 6,
Yes.
and these are very important for our immune system to function easily.
Right.
You cannot consume a lot of nuts, because they're kind of heavy, and some might not even like the taste of walnut because it's slightly turbid.
Yes.
So what you can do is switch to smoothies.
Right.
Smoothies are very easy to consume, and for a mother, a new mom, the less the work, the better. तो आप
Right.
सुबह को उठ रहे हो, morning में breakfast बना लो, get some cucumber, get some kiwis, and if you want, add a bit of spinach, or else you could take walnuts and flax seeds. Put
Right.
all these 4 5 ingredients in the blender, mix it, and add some milk to it. You have some
A good
fresh smoothie
smoothie.
ready.
Right. Very
And
good. Very
आपका
nice.
thank you. I used to do this in my postpartum, and then the difference that I found from having just a glass of milk and then switching to smoothies was amazing. कितना energized लगता था throughout the
Right.
day, and a new mom actually needs all the energy she can get.
Right.
Okay, so that was about recipes. Moving on to our next question.
Yeah.
Um, what is the Ayurvedic way of building a long term immunity in the mother and the child? When a child is grown up, how can we build their immunity so it lasts them longer?
Yeah. So, according to Ayurveda, we usually start the day with a herbal tea. The herbal herbs that you can make instead of tea or coffee, start your day with a warm water which has the decoction of herbs like tulsi, mint, ginger. So you can put pepper, that is the black pepper, and cloves, cinnamon, cardamom. It will turn out to be a very healthy and a tasty herbal tea. So mother can have it. This will help to cleanse the respiratory system also, and also it will improve the digestion of the mother. So this will work like a detoxifying water in the early morning. Also, the mother can have turmeric, has curcumin. Now to digest the curcumin, little amount of pepper is required. So one can, if you don't like to have water or tea in the morning, you can have milk with turmeric and little of pepper put and boiled, which we usually in Ayurveda call it as golden milk. So this
Yeah,
will
haldi doodh.
haldi doodh. So this will definitely boost. Turmeric has got so many qualities, innumerable qualities. It's right from antibiotic to antibacterial, antifungal, plus it is anti-arthritic, anti-cancerous, and so many good qualities. Like if a mother starts taking turmeric on daily basis in some form or the other in meals, or have this haldi milk, it will definitely boost her immunity. And if she breastfeeds the baby, it will help the baby also to boost her immunity through the milk. So turmeric milk is one of the another method which the mother can use it to improve her immunity in Ayurvedic way. Also in Ayurveda, we insist on a diet which is well balanced and healthy nutrients. In Ayurveda, we insist on 6 tastes. There are 6 tastes which every day a person should take in. The 6 tastes are sweet, sour, salty, bitter, astringent, and pungent. So, if you cover up all the vegetables and fruits, so specifically the seasonal fruits and vegetable and the seasonal vegetables, most of them will contain all the 6 tastes, which if a mother takes it on daily basis, it will help to improve the digestion also, and also it will help the mother to boost her immunity. Also, liberal use of spices should be done in her food, like because the spices have got ORAC, that is the oxygen radical absorption capacity. Like the spices like turmeric, cloves, cinnamon, nutmeg, ginger, tulsi, mint, all these have a high proportion of ORAC. So when these are taken by the mother on daily basis, it will help to improve her respiratory system and also will help to build her immunity in a very, very natural way. Okay, and in Ayurveda, we have got rejuvenation therapy type of herbs like amla is there, ashwagandha is there, giloy is there, brahmi is there. So it is very good to have any of this herb in natural form also, or from Dr. Vaidya's we have got even Herbal Fit, which has most of these ingredients in the capsule form. So there's no mess to collect all the different ingredients and mix it up and have it on daily basis. Just one capsule a day will help you to cover up with all these requirements which a mother needs. Also, Chawan Prash on daily basis we recommend for the mothers if she is not diabetic, because Chawan Prash contains all the ingredients which are good for all the systems of the body, right from digestive system to respiratory system and to the intestine also. And it helps to build up the tissues. Also, there are brain tonics inside it, like Brahmi, Ashwagandha, Shatavari in Chawan Prash. So that can help to even boost the brain or brain and nervous system of the mother. So capsule Herbal Fit is what I would recommend. Chakash for children, because Chakash toffees at Dr. Vaidya's, it also contains Chawan Prash to some extent. And since children would not like to have Chawan Prash, they can have these toffees. No doubt the proportion of Chawan Prash is less, but definitely the child would enjoy eating the toffees and can have it as many as they want. Instead of eating the toffees, they buy it from markets. This will work in two ways. The child enjoys the toffees also, and in return would get the benefit of having a nutritive medicine inside the body.
Absolutely. So, for kids, it's like something is better than nothing. अगर बिल्कुल भी च्यवनप्राश नहीं खा रहे, तो at least through the toffee,
Thoda.
little bit of the amount is going in their body. I think as a mom, one would be happy.
Yes, right.
Okay, so having a talk on immunity and not talking about COVID will be really wrong and injustice.
Yes.
So we have to cover up a bit of COVID-19. So the thing is that because of COVID, people started, living room conversation, immunity had become. And the reason being, people found out that, yes, you're having a low immunity. That's the reason you're more susceptible to COVID-19 virus. So, another thing comes into picture is the flu season. Now with on off rains coming, anytime changes in the weather and the flu season being there, the symptoms of flu and COVID-19 are pretty similar. Both have cough, fever, mild body ache. So it's pretty difficult to differentiate. So can we talk a bit about what are the symptoms of flu and how we can differentiate them from COVID?
Yeah. So flu symptoms, like almost as what you said, they are similar. Like the person is having cough will be there, fever will be there, stuffy nose will be there, and weakness will be there. But as what we have understood in the last 7-8 months about the COVID, how it progresses, COVID, as far as I know, the progress is very slow. Like 7 to 8 days it takes to take its take to its optimum stage where the COVID can be detected. Flu, immediately within 1 or 2 days, there will be high rise of fever and running nose, stuffy nose, and sore throat. And I think with simple antibiotics, or say if we give this herbal tea, the mother can be this respiratory system symptoms can be brought under control. Also from Dr. Vaidya's, we have got huff and cough kada is there, which we have. It's very good. It does not contain any of those messy methods of your mixing up all the different herbs and then boiling it and straining it. It's an instant kada like tea. Just take half teaspoon in a cup of hot water, mix it and have it twice a day or thrice a day. It has all the ingredients that can help to improve the respiratory system. And also to mothers, we do advise pranayama, that is breathing exercises that can help to strengthen the lungs for the mother. And for child, the best thing is that he can have the golden milk. Chakash is good, and Chawan Prash, if the child is able to eat in form of a jam, can be spread out on a bread, can be given it to the child, and this is how one can improve the immunity.
That was really interesting. So we could also talk a bit about patients or people who have been affected with COVID-19 and how does their rehabilitation happen after. So अगर आपको कोविड हो गया है उसके बाद में what to expect, आपके symptoms कैसे ठीक होंगे, कितना समय लगेगा. So let's talk a bit about that since
Yes.
you spoke about lung rehabilitation, so I thought let's do that.
Yes.
So if someone's been affected with COVID-19, so you have to assume that no, it's a viral disease. Viral diseases take anywhere between a month to even 6 months to
Right.
recover, for make the patient recover completely, and that absolutely depends upon the person's immunity to begin with.
Right.
कि आप to begin with कितने strong थे, आपके body का immune levels कितना था, उस हिसाब से आपको time लगेगा improve करने के लिए.
Right.
Now, एक बार COVID हो जाता है, उसके बाद में there are many symptoms which will still be there. There
Right.
will be breathlessness, there's going to be body ache and a generalized feeling of weakness.
Right.
We've had patients complaining कि कुछ काम करने नहीं होता है, उठने ही
Right.
नहीं होता है, मन ही नहीं होता है. The thing is that yes, it's both a psychological effect as well as a mental, a physical effect, the weakness.
Right.
So how to there's a post COVID rehabilitation program. Now how this goes by is first we'll try to tackle the breathlessness because this
Right.
is there in many patients.
Right.
Primarily COVID is a lung disease, so it affects the respiratory system. Of
Right.
course then it moves on to a multi-organ disease, but first the lungs to be affected. तो अगर आपको mild या moderate disease था, आपको hospitalization हुआ और उसके बाद में you were discharged and all you had was a post COVID pneumonia, तो
Right.
अब क्या होगा कि you might experience breathlessness.
Right.
You have to take it very slow. Remember one thing कि आप पहले जो करते थे कोविड के पहले, like if you're a mom, okay, and you used to do all the household work, take care of the kids, do the dishes and everything, you will
Right.
not be able to do all of that just at that instant. The moment you're discharged and you come back and you get on with your work, that's not how it's going to happen.
Right.
Your body's going to need a lot of time to recover.
Right.
So what we have to remember after this is take it slow. Try to do one thing at a time.
Right.
And if at all you feel breathlessness, what as a physician I want you to remember is there could be a few complications that it should be warranted that you have to visit your or at least call your physician as soon as possible.
Right.
So breathlessness is going to be there, but if you have sudden acute onset breathlessness, what does that mean? आप suddenly बैठे हैं, आप कुछ भी नहीं कर रहे हैं, या फिर आपने suddenly कुछ weight उठाया है, कुछ काम किया है, आपको बिल्कुल एकदम से breathless हो रहा है. This is called as acute sudden onset breathlessness.
Right.
This isn't normal. This you are not supposed to be waiting कि हाँ कुछ नहीं ठीक हो जाएगा, विंडो के पास जाके खड़े हो जाते हैं, it will get well. That's not it. It might be a pulmonary embolism, it might be acute respiratory distress syndrome, and these are some common complications seen in post-COVID era. So what
Right.
you got to do post-COVID situations, what you got to do is contact your doctor as soon as possible to ask him what you should do, or best is to rush to a hospital when you know you've been inflicted with COVID or have a history of hospitalization.
Right.
And if it's not sudden onset breathlessness, say it's just gradual breathlessness, आप hospital में थे तब आपको था, अब उससे काफी कम हद तक है, but it's still not normal. काम कीजिए, remember your body's cues. अगर आपको breathless हो रहा है, आपकी body नहीं ले पा रही है, तो you have to stop it then and there. Don't try to push your body saying कि नहीं नहीं हम कर लेंगे, हो जाएगा, थोड़ा ठीक हो जाएगा. It will only worsen.
Worsen. Right.
Being your lungs are weak, you've just had a viral infection, so you have to give it time to recover, so try to take it slow. Other than that, in there are certain lifestyle changes which will help greatly for these people. Sleeping position, when you're having breathlessness, it's actually very difficult to sleep कि कोई भी position में आराम लगता ही नहीं है, कहते हैं कि दम continuous लग ही रहा है. So what you can do is always try to keep your head elevated. So if you're sleeping, try to keep a few, say 2 pillows under your head so that the head is at a higher level than the heart, so you won't be getting breathlessness. Or if you are standing and talking, so try to always lean towards the wall, or if you are in the window, so lean towards the window in front. That support to the upper body will give support to your respiratory muscles, and
Right.
then the pressure is not going to be there on the respiratory muscles while breathing. You will feel much better.
Right.
Another post-COVID problem we have is the cough accumulation, bulgum, which they call phlegm.
Right.
So there's a lot of it, and people find it difficult for
To
months.
throw
It can be
out.
very
Yes.
distressing. कि बलगम बाहर ही नहीं आ रहा है,
नहीं आ
क्या
रहा.
करें, स्टीम ले
Right.
रहे हैं, we're having milk
Hmm.
and everything. Of course, we need to do the medications and the dietary restrictions for it, like avoiding oily foods and stuff. Steam inhalation will help over time, but a simple lifestyle change, that is how you are sleeping, will help to drain the lung of that side. What I mean by that is, aapka doctor, when you go for an x-ray, the doctor will tell you whether both sides of the lung have phlegm accumulated,
Right.
or one side. So whichever side is affected, we have to aim at draining that side of the lung. Now, in this rehabilitation program, it's very simple. Whichever side you feel are advised to sleep, it's actually called physiotherapy. What you got to do is sleep on that affected side, so that there is more draining via gravity. आपको gravity के जरिए सारा की सारा phlegm बाहर निकालना है, so that through cough it all comes out.
Right.
And similar sleeping positions, like I mentioned earlier, for breathlessness, elevated positions. आप legs को flat रखे, head को elevated रखे. ये position से वो side affected lung का जल्दी drain होगा, and your cough will be able to come, your cough will come out sooner. And steam inhalation will help to decongest the throat. And like you mentioned, kadhas work wonders. So kadhas, they actually have an antioxidant effect as well on the immune system. So in a post-COVID period, they're going to be really helpful.
Right. Exactly.
Anything else you would like to add on the, the cough part of it, or the rehabilitation of the lung part of it, from an Ayurvedic point of view?
Yeah, from Ayurvedic point of view, we advise the patient to do pranayam. Pranayam are breathing techniques which will help the lungs it will help the lungs to tone up very well, because when you do pranayam, the natural oxygen enters inside your respiratory system, and that will help to tone up the lungs. So pranayam is one of the method we implement on patients who are recovering from post-COVID. And also kadhas, as what you also agreed upon it, is one of the best thing, because that will help to detoxify and try to throw out the phlegm inside the lungs. It will because they have the capacity, but only thing, the frequency of taking this kadha should be increased. And also
Absolutely.
having vitamin C as on daily basis, and vitamins through vegetables and fruit juices can also help to develop the lost immunity.
Absolutely. Another word on the breathing techniques. Let's highlight the importance of that. So there's a particular way in which you got to breathe, so that your breathlessness is eased. ताकि आपको आसानी हो. So when you are admitted to a hospital, your lungs get deconditioned. That means you now breathe differently, and you are not even aware of it, because that's your body's way of responding to any kind of stress when it comes to respiration. So
Right.
what will make it better? When you've been discharged, you're at home in your rehabilitation phase, you got to practice something called a pursed lip respiration. It's nothing, it's simple, wherein you got to breathe in from your nose and breathe out from your lips, keeping them pursed. That means in a circle. You
Right.
got to breathe like that. So when you have consciously put an effort on that, slowly your lungs will come back to this kind of breathing.
Yes.
Scientifically speaking, what this is, it's going to help the lungs open up better, and once the lungs open up better, it will be easily drained of all the phlegm that has been accumulated.
Right.
And another thing is, how do you know that your lungs have already been deconditioned? कि आप already आपका breathing में problem आ चुका है, ये आपको कैसे पता चलेगा? So all you got to do is keep one hand on your mouth, another hand on your belly, and you breathe. Now, whenever you normally breathe, your tummy is supposed to go in front. It's supposed to inflate and become big. But when we are affected, our body doesn't want to put too much pressure on our respiratory muscles, so it does the opposite. You will note that the tummy goes inside when you're inspiring. इससे क्या हो जाता है? One of the important respiratory muscles, the diaphragm, it's called a big dome muscle, which divides your chest and the abdomen. So
Right.
that the pressure over the dome muscle is very less. So that's why the body says कि ठीक है, अब हम ऐसे breathe करेंगे. You got to teach your body to come back on track. Start practicing pursed lip respiration, and by this, पहले तो आपका breathing काफी कम हो जाएगा. You're going to feel much better, and second, it will help your lungs, like I said, open up.
Yes, very nice. Great. It was great listening to you, Dr. Rahat. We learned a lot from you. And
Thank you.
definitely, I
Same
think
here. Same here.
all the viewers who must have heard you also must have learned a lot from all this. There were many people are ignorant of many things, so it's
Yeah.
best that they must have got lot of pointers about all the sex whatever session today we had.
Absolutely. And we had some amazing insights on Ayurveda from you. And I mean, Kada, Haldi Doodh, we've always heard of those. Our moms have been pressurizing us for that. But then we got to know the actual science behind it. And now
Yes,
it's more palatable. I'd really like to take it more now. And I'm sure
yes,
other moms as well.
yes.
So, should we call it a session, Andrea? Do we have any questions? Okay, so I guess that's it. Thank you, viewers, for joining in, and do keep listening to Baby Chakra. Keep watching and stay tuned for tons and tons of information on parenting and health tips. And of course, do check out Dr. Vaidya's website for all the products that we mentioned today: Herbal Fit, Chakash, and other immunity boosting huff and cuff. That'll be great for all of your coughing problems. Thank you so much. Have a great day.
Thank you very much. Thank you, Dr. Rahat, and thank you
Thank
all
you
the
so much.
viewers and Baby Chakras.